For all the latest updates, subscribe to News 9.
The coronavirus pandemic shows no signs of slowing down in India. As of July 6, India is third most affected country due to COVID-19. A new study has suggested that Indian women stand a higher risk of COVID-19 mortality than men in the country. The study found that 3.3% of infected women died of the disease compared to 2.9% of men infected with COVID-19. The study analyzed data collected till May 20th, 2020. Case fatality ratio is the ratio of confirmed deaths to total confirmed cases. The study noted a high CFR among Indian women when compared to in Indian men. This is especially true for women in the age group of 40 to 49 years.
A higher CFR among women is largely driven by a significantly higher risk of death among women in the age group of 40 to 49 years. In all other age groups, including the elderly, we find that the mortality risk among men and women is more or less similar.
This trend in India is not similar to the trend witnessed in other countries where men stand at a higher chance of dying from the disease. However, the study warns that the inferences should be carefully interpreted. Although the CFR shows that Indian women stand at greater risk of COVID-19 death, in terms of overall numbers, more Indian men are diagnosed and die due to the virus. This can be attributed to fewer COVID-19 tests being conducted on women. Between January 30th and April 30th, of all the tests conducted in India, 67% were on men, proving that COVID-19 testing on women is lacking in the country. Although more men in India have contracted the virus, of the people tested, a higher proportion of women tested positive. The data shows that 4.2% of women tested positive for COVID-19 compared to 3.8% of men. In India, a higher proportion of women are malnourished and anemic than men in the country. However, a higher proportion of men have pre-existing conditions and comorbidities. Both comorbidities and malnourishment are high-risk factors for the novel coronavirus. Globally, more men are dying of the dreaded disease than women, according to data from Global Health 50/50. Of the 47 countries for which sex-aggregated data is available, more men died in 42 countries. The researchers have announced one main limitation of the study was that data was gathered through crowdsourcing, which is not as accurate as official data. Researchers warn that testing in the country is at a very low level. A high rate of testing can change the pattern. The researchers have warned that more data and analysis is needed before drawing a conclusion from this study.